So when I look at the brilliant women in digital health from even last year and the year before, they've got amazing stories and backgrounds, and it just inspired me, but inspires others, and I hope that I can provide that inspiration to others.
Historically, and I guess traditionally, IT has been a really male-dominated space, and even though healthcare, particularly nursing, has been very female-dominated, we're still only starting to see that change, particularly in digital health, and that there are so many great women coming through, doing some really great things and really providing some great diversity to the industry. That's really important.
I think it's recognition of all the invisible work that happens in the back room that most people don't see. The front end's very visible, but what actually goes on behind the scenes is never often acknowledged.
We work very hard, I work very hard and have done for many, many years, and you're head down and doing the work. Not really expecting recognition, but for that recognition to come along is something that makes me incredibly proud.
It's absolutely wonderful to see Telstra Health recognising the contribution that all people in digital health make. I'm particularly excited about the recognition that this provides for the consumers that help our work, the academics, the clinicians, and the government and academic institutions that support this work. So really, I think this is an award for the team, not for me.
My job is to help workplaces make sure that they have a psychologically safe workplace for their workers to come to work every day and for their business to thrive.
Well, firstly, I'm a registered nurse and a midwife, and I developed a software program called TrendCare, which measures the workloads for allied health, nursing and midwifery.
We have one product already in market called Life Whisperer that is using AI to analyse images of embryos during the IVF process. And what Life Whisperer does is it helps doctors to pick the very healthiest embryos, or the embryos that are most likely to lead to a pregnancy for the patient first time, so that that patient doesn't have to go through needless IVF treatment cycles.
I am proud to be able to contribute to our health system's transition into this new digital health frontier. It becomes even more important for a solid foundation of clinical governance to be established in order to ensure that these new health technologies not only safeguards the current standards of clinical care, but also seeks to continuously improve the quality of care we provide.
I am most proud of the contributions I have made in the field of automated speech therapy. And that's because about 50% of the children in Australia do not get access to the speech therapy they need. With our system, we can provide children with automated tools which are integrated in a game that keeps them engaged during their speech therapy, which they can then do at home and be remotely monitored like clinicians.
One of the programs of work that I'm most proud of, that's called the Pain Health Initiative. The idea behind it was trying to ensure that regardless of where in Australia you live, you can access credible, integrated, holistic care that supports your chronic pain condition in a helpful, meaningful way.
So the technology I have developed delivers solutions to multiple high-profile health problems. Using this technology, we've been able to identify risk factors for diseases such as motor neuron disease, as well as cardiovascular disease. And I think what I'm most proud of for this work is that it's directly translated into clinical practice. So disease genes we've discovered are now being used in diagnostic tests worldwide for patients who do have motor neuron disease.
I'm really proud of the system that we've developed here that's already in use by 5 laboratories and has already supported over 10,000 tests to people here in Victoria. We've shown how genomics can provide answers and change care in people, and literally this is going to benefit thousands of people across Australia. So I'm really proud of the system that we've developed here.
We are working with aged care providers across the sector to better utilise existing clinical information systems to monitor and deliver better patient care. We have just commenced a very exciting project which will establish a national medication aged care roundtable. And this really is only possible by harnessing the power of digital systems.
I think I'm most proud of that was called the TEX-ME study, stands for Tobacco, Exercise and Diet Messages. It was a clinical trial that many cardiologists refer to this study when they think about digital health and heart disease, and many cardiologists can see, or many have understood, the potential role of digital health through this research study.
I helped to build an app called Bright Tomorrows to help parents and carers with their young children to improve executive function or their everyday life skills. And it makes me feel fantastic. I couldn't be more proud of the work that I've done.
The And Health programs, both And Health Plus and And Health Masterclass, our graduate companies that have been through those two programs have now impacted over 775,000 patients.
So I'm most proud of the contribution I've made to workforce and education. I was the coordinator of the very first program here in Australia for health informatics, and since then I've been involved with developing competency standards.
Just in the last week we've had our first patient from one of our projects who has got a diagnosis they would not have otherwise got if it wasn't for our study. So that means that their health is going to be maintained for over a decade longer than it otherwise would have because of the information that we've been able to get to them.
I'm really proud of the digital innovations that we've made at Alfred Health to improve medication safety. A lot of these innovations are now being rolled out at other hospitals across the country.
So we provide health IT platforms for developing countries. So they're a lot easier to use, easier to access, easy to get data in and out of than some of the platforms that you might find in Australia. So they're designed specifically for the Pacific Island setting. I went to the Solomon Islands and volunteered there and completely changed what I thought I would do with pharmacy. So take 2 years off and go and volunteer.
When I first started my career, I saw a stat that women are significantly less likely to apply for promotions, to challenge their initial salaries, or to speak up in meetings. So I've always just aimed to challenge those stereotypes and change that statistic, not only for me, but for my mentees as well.
Give it a go. You don't often know where you're going to end up with your career, and often it's quite different from what you study at university, and not everyone learns in the same way. School kind of trains you to go in one direction, and not everyone actually kind of functions in that fashion. So try it on for size, see if it resonates with you, and then give it a shot, because you never know where you'll end up. And also go and have a play with a computer. We're not all nerds, a lot of us are, but there's a lot of space for different people in this world.
Although health is soundly grounded on tradition, digital health is a fast developing and broad field. You can make your mark in any area, any particular advancement, such as you can improve diagnosis assessment.
The best career advice I've ever received is that your career is really more of a journey than a goal. I used to get quite anxious trying to figure out what it was I wanted to be in my career or how to be the best in my role. But that advice has allowed me to relax into my role and really enjoy the journey of adapting and learning throughout my career.